Thank you.
Can you please introduce yourself to the guests?
My name is Dr. Ranganai. I'm currently working with the Department of Medicine at Mpilo Central Hospital. Yeah.
Okay, today we're going to be raising awareness on diabetes. My first question is, what is diabetes?
All right, so diabetes basically it's a disease where somebody has high levels of sugar in their body and certain parts of the body are not able to utilize it, like the muscle and so forth. So essentially it happens when somebody has a dysregulation in the insulin, so it's like his insulin resistance. So, or a certain like relative deficiency in the insulin, so probably not producing enough insulin, or the little that you're producing, your body organs are not responding to it. So in the end, since insulin is required for glucose control, you end up having a lot of glucose in your body, and those high glucose levels are then responsible for the symptoms that one feels in diabetes. Yeah. So in short, I think in a nutshell, that's how I would describe diabetes.
Okay, diabetes. I've heard that there are different types of diabetes.
Exactly.
Okay, what are those different types of diabetes?
So for starters, I would just say there are two types of diabetes. In fact, there are actually many types of diabetes, but generally the most common type 1 and type 2. Where type 1, this is where somebody is actually absolute insulin deficiency, like the cells in the pancreas that are responsible for insulin production, they're not producing enough insulin.
Okay.
Type 2 diabetes is the one that we are usually familiar with. I'm sure some of us along the way we've heard that, we have insulin resistance and so forth. So type 2 diabetes, this is a person who is obese most of the time, typically, and they have the insulin, but their body organs are not responding to the insulin. So typically the muscles and so forth. But you also have other types of diabetes, like the one that can happen in pregnancy, typically known as gestational diabetes. There are also other rare forms of diabetes that can also happen as a response to drugs, for example. There are certain drugs that can, interfere with insulin function, resulting in what? In diabetes. So most common, type 1, type 2.
Type 1 and type 2. Okay, yeah. I've heard that type 1 can be genetically passed on to you.
Okay, so typically actually it is type 2 that is a genetic component.
Okay.
Then type 1 usually it's when you have autoimmune, or like your body's immune cells are destroying the cells that produce insulin in the pancreas. So in the end you end up having fewer cells to produce the insulin. So your sugar start to accumulate in the body. So remember the phenomenon that I told you about initially, that you have all the sugar, but your muscle is not using it. Okay. So if you see that a patient will start losing weight, yet they have high sugars in their body, because their body organs are not able to utilize that. So usually type 2 is the one that is sort of like a genetic component, most of it. You have, if your auntie, your brothers, your mother, your father also have type 2 diabetes, you have a higher chance of getting diabetes. So you need to be on the lookout actually, or you need to actually just live a healthy lifestyle so that you lessen at least your chances of getting diabetes.
Yeah. Okay, and what are the tests that are done to check for diabetes?
So generally for you to make a diagnosis of diabetes, a patient has to come with the symptoms. So they're feeling extremely thirsty, they have a dry mouth, they're also feeling a little bit weak, they are going to urinate a lot, they are taking a lot of food. Remember, this is what I was telling you in the first, you have glucose in your blood,
yes,
but your organs are not really feeling it. So it's like you're in a dam of water, but you're very thirsty. So your body organs will interpret that system as a system of hunger. So it tends to take more food, but that glucose is going to accumulate in your bloodstream, and then you're passing it out through the kidney. So when the glucose passes out through your kidney, it also passes with water. So most of the time you find yourself running to the toilet, and you're also taking a lot of water, you're also feeling hungry most of the time. So the first initial test that people usually do when somebody comes to a hospital is a hemocheck. It's a random blood sugar level where you just test your blood sugar levels. Then the other test that you can do, you can actually do, there's one which you call an HbA1c. So this one actually gives us, how has been your sugars over the past 2 months.
Okay.
So over the past period, maybe 3 months. So HbA1c talks more about the long-term control. and also use it as a form of determining how we are going to manage our patients. So majority of the test, generally in our setting, we just do a hemostick. If it is concurrent with the symptoms, then you make the diagnosis. Or if you have your HbA1c, or you can actually do what we call a oral OGTT, an oral glucose tolerance test. So you put somebody on a load of glucose, and then you test after 1 hour, after 2 hours, and then you can actually make your diagnosis of diabetes mellitus.
Okay, with those tests that you have mentioned, what would you say are the normal values that one can expect if they're in the safer range?
Okay, so normally glucose levels, the normal one, fasting, that is, you've not taken any meal in the past 6 to 8 hours, we expect your glucose levels to be between 3.6 to 6.1. But if your glucose levels are then between around about 7 and going onwards, and they are fasting glucose levels, this one is certainly a diabetic patient. But if they are between 6.1 and 7, this is somebody who say they've impaired fasting glucose or they are developing insulin resistance. So it's not yet in the diabetic range, but they are sort of like on the pathway to diabetes. But not most of our patients come to us, they are not fasting. They've taken their meal, they've taken their everything. So we slightly use larger ranges. So if it is just a random sample, like I come to you and do a more check, if it is less than 7.8, I'm happy.
Okay.
But if it is between 7.8 to 11, that is impaired fasting glucose. You're starting to develop insulin resistance.
Okay.
So it's sort of like a warning sign. Then if it's greater than 11, certainly this patient is diabetic combined with the symptoms of excessive thirst, weight loss, passing a lot of urine, and excessive appetite.
Okay.
Yeah.
There's a term I've heard about pre-diabetes. What is that?
So pre-diabetes, that one that I'm actually defining is impaired glucose tolerance. So some of you may actually talk of insulin resistance and things like that. So it's essentially talking about this period where somebody is not overtly diabetic, but their sugar levels are not within the normal range.
Okay.
So this is somebody with a random blood sugar of between 7.8 to 11. So this is a person that has pre-diabetes. They are sort of like moving toward their diabetes. So with any of chronic or non-communicable diseases, it's not like you have a full-blown thing like a flu. It's like you have a spectrum from a normal, and then somebody is moving towards, and they become overtly developing the disease. So you can actually see that somebody is if they have impaired fasting glucose or they are pre-diabetic, if they change their lifestyle, their glucose levels may actually come back normal. Well, there are certain things that will be driving the insulin resistance. Like if you're obese and have a lot of fat, we know that fat in the body opposes the action of insulin.
Yes.
So if somebody is obese, usually most of them will have what?
Diabetes.
Impaired fasting glucose or pre-diabetes.
Okay.
So they are sort of like moving towards diabetes. So when they come to an expo or some health convention, it is that somebody has these abnormal glucose levels that are not diabetic. You need to warn that patient, better change your lifestyle and eat healthy and start to exercise, stop smoking and things like that.
You did mention a type of diabetes, gestational diabetes. Would you like to talk more about it?
So gestational diabetes is the one that develops in women that are pregnant. So the diagnosis is made in one who was not diabetic at first. But now from 20 weeks of pregnancy, they come to you with signs and symptoms of diabetes, or they come to you with sugar levels that are in the diabetic range.
Okay.
So this is a patient that is developing diabetes in pregnancy. So in pregnancy, the hormonal milieu of the body, there is sort of like an antagonistic action to insulin, and also at the same time you have increased insulin demands, and also you have a lot of your estrogen and progesterone. You also have a lot of your steroids again, and thyroid hormones going up. All these tend to drive to a rise in a glucose glucose rise. So this patient tend to develop diabetes, and usually happens from 20 weeks of pregnancy. The importance of us managing that is that there are certain risks associated with what? With gestational diabetes. So in summary, to try to just simplify the term, this is diabetes that develops when one is pregnant, who was not previously diabetic before.
Okay.
So this is one person has been okay. They've been fine, doing very well. But come 20 weeks, they have a lot of glucose in their urine. They are feeling thirsty. They've elevated sugar levels. Then you diagnose them with gestational diabetes. Actually, the importance of us knowing about this is that these people are at an increased risk of getting diabetes in the long run.
Okay.
So you really recommend this person to have random sugar levels even after delivery. And also the importance of tight glycemic control for somebody who is pregnant. The importance is that you want to protect the fetus. A lot of glucose in your body can be very toxic to your growing baby.
Yes.
And it freely closes your placenta. So you need to make sure that there's a tight glycemic control and the fetus develops very well. The other chances, obviously, is this is a person that is also at risk of, complications due to delivery and stuff like that. So you need to monitor them closely. You also need to monitor the size of the fetus. Sometimes the fetus might actually be quite big.
Yes, I've heard about
And
that.
they might actually not be able to pass through the pelvis. So you need to know that and you plan, your delivery. And also when the fetus comes down, and soon after delivery, they're also at a risk of getting low glucose. Because remember, they've been inside the mother's womb, sharing the high glucose levels. Now their pancreas is sort of like used to a high glucose state. When they suddenly come out, that high glucose state is no longer there. So your child will be at a risk of getting very low glucose. That's why we actually monitor them quite closely, even soon after delivery.
Okay.
Yeah.
Who is at more risk of developing type 2 diabetes?
So type 2 diabetes is the one that is the most common. I think about 90% of our diabetic patients have type 2 diabetes. So those that are obese, we define obesity as a body mass index of greater than 30. So body mass index, you are simply trying to find your weight divided by your height squared. So this will help you if you have a good weight, if your body is proportionate. So obese people are at increased risk of type 2 diabetes. People that have a family history of type 2 diabetes. So your aunt, your brother, they have type 2 diabetes, you're at a greater risk. In patients that office jobs doing nothing, that usually their lifestyle is sedentary, they're also at a greater risk of getting what? Type 2 diabetes. The other thing, people who smoke, because when you smoke, you have a lot of those toxins getting to your body. They cause elevation in the blood pressure. They also cause elevation in your blood sugars. So somebody who has type 2 diabetes, if they are smoking, they have to stop. In patients that also have lipid disorders, when you're talking of lipid disorders, you say abnormalities in the body fat.
Okay.
So these people probably it's genetic in the family and things like that. They are actually at a greater risk of getting type 2 diabetes.
Okay.
And also people, lastly, that have diseases of the pancreas, like you have chronic inflammation of your pancreas, for example, you're at a greater risk of developing type 2 diabetes as well.
Okay. And what are the common signs of type 2 diabetes?
So usually patients with type 2 diabetes, they usually come complaining of excessive thirst. They really, are taking more than maybe 5 liters or so of water per day. And every time they are drinking the water, because they have a lot of glucose and it's coming out of the kidney are overwhelmed. They can't hold on to that glucose so much. They are also rushing to the toilet. So usually if this is somebody who has been going to work, they really feel so disturbed that at every 30 minutes I'm just rushing to the toilet to pee. And at the same time I really need to have this 2-liter bottle of water by my side. And at the same time I'm feeling really thirsty. Dry mouth. Some may even start to lose weight because the muscle is not utilizing all the glucose because of the relative insulin deficiency. Yeah.
Okay. And why is it important to do regular checkups for diabetes?
All right. So according to statistics, what we actually know is that majority of the people, in fact, 50% approximately, of the people that are diabetic, they actually don't know it. So they are living in the community, happily ever after, but they are diabetic.
Yeah.
So they will come to you probably with a complication. They come with a stroke, they come with a heart attack, they come with chronic kidney problems. So it is very important to get just regular checkups. Peradventure, you are pre-diabetes. You actually have a chance to change your lifestyle and you may actually reverse the process. And also, if you are diabetic, you get diagnosed early, you get managed early, you have good glucose control, and you prevent complications. Yeah, so it's very good to have those, regular checkups to see how your blood glucose is doing.
Okay. Let's say, for instance, if you're not diagnosed early, what are the type of treatments that you offer for diabetics?
So in type 2 diabetes, this is how usually when we start on metformin. Usually, I talked about the HbA1c earlier, with the one that tells us how have been your blood sugar levels over the past period of time. If it is a little bit high, sometimes we'll actually start you on metformin plus insulin. In type 1 diabetes, these are people that are not producing enough insulin. So no role for metformin. They will just need what? Your insulin straightforward. And in most cases of type 1 diabetes, they usually come, they are young, but it can also happen in adults. But in type 2 diabetes, there are actually a lot of other therapies that are coming up. Usually the baseline which we start is metformin, but there are other types of drugs that are even undergoing trials that also have beneficial effects upon the heart. So new trials are coming up, and we hope to incorporate more and more of them in our clinical practice.
Okay, and how do patients with diabetics know that their diabetics is the diabetes is well controlled?
So definitely, if your diabetes is well controlled, one, you don't have episodes of very low glucose or episodes of very high glucose. You actually encourage people that are diabetic to have a glucometer at home, so that you check before a meal and after a meal. This will actually give you an index of how well your diabetes is controlled. So when you do those glucose checkups, you actually write down the values. When you go for review, at the end of the course, as you grow, since you're going to grow with the disease, most of them eventually they come to know, if this value is like this, I need to act. If the value is like this, I need to act. So with those regular glucometer checkups, and usually we usually target, your blood glucose levels to be between around 7 and 10. It should be a little bit fair. Yeah. So if your random blood glucose is around 7 and 10, we are happy. Probably you're doing quite fine. If it is a little bit too low, probably you're getting an overdose of insulin, and that may actually need to be regulated as well. So that's how, at least the simplest way in which you can actually check if somebody is doing very well. But because we know a spot blood sugar level is not reflective of how you've been doing, usually at hospital every 6 months, we usually do what we call the HbA1c that I highlighted earlier.
Yeah.
This one that gives you, a good spectrum to show you how it's been the control over some time. So if it is okay, then we know that we are doing well.
Okay. You've mentioned that diabetes is a lifestyle disease.
Exactly.
How can the complications of diabetes be prevented?
So the complication that comes about in diabetes is because of the high glucose levels in the blood. So if your blood becoming a little bit viscous, it's becoming a little bit thick, you have strokes, you have kidney problems, you have eye problems. I think we've met our relatives that are diabetic and they have difficulty in seeing. So in the key to prevention of complication, one, you have lifestyle modification, and to also ensure that you have a tight glucose control. So if your glucose control is good, generally you don't develop complications. But sometimes in our setting, we have people that present late. They also present with complications already. They come to you, they're already hypertensive. They come to you, they already have heart problems. They come to you, they already have a stroke. They come to you already, they have already visual problems. But even in those problems, that a tight glycemic control will actually prevent further progression of those of those complications. So the moment you have a tight glucose control, you tend actually to do very well.
Okay.
Yeah.
And when it comes to diet, how is the diet for a non-diabetic different from a person who's diabetic?
All right. So normally in diabetes, we talk of the Zimbabwean henjai, where we're talking of your starch, and then we talk of your fruits and vegetables, and then a bit of your protein represented by this stamp. So we are saying starch, just a fifth maybe of your sadza should be okay. Then majority should be your fruits and your vegetables. And when we're talking of your fruits, we're not talking of the sweeter ones like your banana, both those will cause a rise in your glucose. We're talking of things like cucumber, those are that have less calories, more vegetables and the less sweet things. So in general, the diabetic diet, when you're talking about protein, we usually use, the lion matches box.
Yes.
We usually use that as, a sort of like a measure of the amount of protein that you take, maybe at a meal. Let's say you're taking chicken, for example. You no longer need to take the whole chicken because you have a lot of fat in your body and it fights insulin. So in general, a person who is diabetic, they have to be a little bit more careful with their diet compared to somebody who is non-diabetic. You can't take those soft drinks. I know they are unhealthy in general, but well, a diabetic patient is not offered that indulgence to take, your soft drinks and everything that is sugar because it causes glucose spikes. We only advise you maybe to carry your sweets. In case you have low glucose, you just boost that glucose while it's waiting for your regular meal. Yeah.
Okay. For a diabetic person, why is it important to keep physically active?
So this is what happens when you're physically active. Glucose goes to your muscles independent of insulin. So we talked about what happens in diabetes if a relative or absolute insulin deficiency. You have either the insulin that you are producing is not sufficient enough to cause an effect, or you are not producing enough insulin to cause an effect. So when you exercise, sort of like you hope your insulin. So even when we are talking of the diet, for example, we actually talk about dietary modification. One is planning maybe to go to do some physical activity. Let's say they are planning to do it in the field. Instead of just having one feast, we can say let's take 2 feasts of what? Of your starch. Because we know that a lot of sugar will leave your bloodstream and go to your muscles. So if you are physically active, one, it also has an impact on the dose of insulin. It also has an impact on how your body handles the blood sugar, because the blood sugar also goes to your muscle independent of the insulin. So you're actually like helping your pancreas. At the same time, you are burning the fat that is causing insulin resistance. So it's physical activity, it's golden when it comes to control of diabetes. I cannot overemphasize it. It has to be part of the lifestyle of a diabetic patient.
Okay. Can diabetes lead to serious emergencies?
Exactly, it does. In fact, in type 2 diabetes, we have a common emergency that we call hyperglycemic hyperosmolar state. So this is when you have a lot of sugar in your body, and sugar draws water. So remember, you have both organs, they also have water in their cells. So imagine you have this chronic state for quite some time. You have a lot of sugar in your body, and they are drawing a lot of water from even your brain cells and stuff like that. Those body systems actually try to adapt to that state. They produce some other molecules to try to, to fight off the loss of water. And eventually, this can actually kill when you suddenly correct it. So that's another emergency. The most common one that we usually meet in type 1 diabetes is actually what we call diabetic ketoacidosis. So you have a lot of acids in your body, ketones, because remember your body is saying, I'm starving. So it breaks down a lot of fat. In the breakdown of fat, you have ketone bodies being produced. These are sort of like an alternative form of energy. So the patient becomes acidotic. They also have, disturbance in the amount of electrolytes, that is your sodium, your potassium in your body. And the person can become dehydrated, they come to you confused, they can come in coma, and they may actually die.
Okay.
So the first one that I talk about, the hyperosmolarity, actually has a high mortality rate. Majority of the patients will actually lose them. With the diabetic ketoacidosis, the one that commonly happens in type 1 diabetes, it's a little bit better, but all of them can actually lead to death if not appropriately managed.
Okay.
Yeah.
My last question, how can diabetes be prevented and controlled?
So, with type 2 diabetes, you can modify on smoking, you can modify on your physical activity, avoid sedentary habits. When you're working in the office, have a regular exercise program, eat a healthy diet, avoid a lot of fats, especially the trans fats. You're talking of your highly fried things and stuff like that, saturated fat. You're also talking of a diet that is rich in fruits and vegetables. A healthier lifestyle. Remember, the issue of type 2 diabetes is a genetic component and environmental component. So while you can't do anything about your genes, but you can certainly do something about your environment. You can exercise, you can eat healthy, you can what? You can also make sure that every time you don't, engage in other things that are unhealthy. So generally, you are talking of keeping an active lifestyle, having a regular exercise program. You're talking about having a healthy diet. Screening also helps sometimes. Those regular checkups, when you are now pre-diabetic, you can, take the necessary measures as well. So in general, diabetes is very preventable. Even the type 1 diabetes, if it comes, if you change your lifestyle, the control actually tends to be better. If you read one of the books of medicine, which is my favorite, Kumars and Clark says, there is no medicine that will replace lifestyle changes in diabetes patients. So even if you have all the insulin in the world, you still need to change your lifestyle to have a good control. So you can live healthy, you can exercise, you can have good nutrition, you can take a lot of water, you can avoid smoking and harmful use of alcohol, you can avoid stress, you can have, fresh air and things like that, you can, get adequate rest. All that is very important. Good nutrition. All those principles are very important in making sure that you don't pull the trigger of getting diabetes.
Okay, thank you so much for joining us.
You're welcome.
Thank you for watching today's episode of Health and Living. I'm your host, Sipho Mhlanga, and it's goodbye.